So, what is your most comfortable position? Do you feel more comfortable lying down, or do you feel more comfortable sitting up?
I think more comfortable standing.
Standing, okay, or sitting?
Yes.
Okay, alright, in that case we'll do some treatment in sitting first. And so I've decided we're going to use some TENS treatment today. So TENS stands for Transcutaneous Electrical Nerve Stimulation. And what it does, it blocks your pain gate at the area of your spinal cord. So it prevents the pain transmission to your brain. You can feel when pain sensation is really weird to you. So I want to use this treatment first to see if it's a suitable treatment to bring down the level of pain a little bit. Because if you have so much pain, I don't think we can do any other therapy right now, such as exercise. So I want to see if we can bring down the pain first a little bit. Does that sound okay for you?
Yes.
Okay, that's great. So to make sure that you are safe during the TENS treatment, I need to ask for some contraindications first. Alright, so do you have any electrical implants like pacemaker, deep brain stimulator, cochlear implant? Okay. Do you have any malignancy such as cancer? Okay. Do you have any tuberculosis in the chest? Okay. Do you have any active DVT in the legs? Thrombophlebitis? No. That's good. I'm also going to inspect your skin in a minute because I need to make sure that you don't have any infectious skin disease or any open skin because that would be dangerous with the electrical stimulation. Alright, so let me tell you a little bit about the stimulation. So actually you should just feel comfortable tingling. Okay, so it's not very strong, it's just very comfortable. And I'm going to check your skin sensation to see if your skin has normal sensation first. If you feel anything like sharp pain or anything that's uncomfortable during the treatment, please let me know because then you're at a risk for skin burn. Is that okay?
Yes.
Alright. Okay, so let me get you set up first. Okay, so now that you are comfortably seated and your neck area is exposed, can you just tell me where you feel the most pain? Is it around here? A little bit here?
Yeah.
Around here, and it's on both sides, right?
Yes.
Okay. How about down here? Nothing. More around these two sides. Alright, so I'm going to check your skin sensation first. And I can also inspect your skin so I can see that your skin is in good condition. There's no open wounds, there's no skin problems, no eczema or anything like that. Alright, so the skin test is just a sharp and blunt test. So you can see here, this one is blunt, this one is sharp. Can you tell the difference? I'm going to check on your back now. Okay, so I'm going to start now. Tell me what you feel. Okay, so your skin sensation is very normal. I'm now going to show you that the machine works first by testing the machine on myself. Okay, so for this treatment, I've decided I'm going to use 2 small electrodes and some gel with some adhesive tape. And I'm just going to check that the machine is working normally, so I will choose electrotherapy, and then I'm going to go for the pulse biphasic. And because he's got quite a lot of pain, I will go for the asymmetrical biphasic TENS. I'm going to increase my frequency to 100. And I might
have a little bit of frequency modulation as well, so there's no accommodation, maybe 20 hertz, so it goes from 80 to 120. Now my phase duration is going to be a lot smaller because I just want to hit the sensory nerve, so I'm going to put it to 40 microseconds. And I don't need vacuum. I'm not going to use amplitude modulation today because I already have frequency modulation, and I also don't need cycle time, so I'm just going to check if that works. So just by holding the electrodes like this between my fingers, I'm just going to see if I can feel a tingling of the electrode in my fingers, and I've got it in the correct channel. Let me check. Yes, so on channel 1, I've turned it on channel 1. Okay, now I can feel a little bit of tingling. Yeah, now I can feel tingling. So you can see that the intensity has to be quite high for me to get any of my sensory receptors working, because you remember your strength duration curve, the smaller the pulse duration is, the more intensity you need to actually stimulate something. So I expect that I will be using quite a lot of intensity for him. Okay, so I'm going to turn that down. It works well. Okay, so the machine works very well and we are ready to start the treatment. So I'm going to prepare the electrodes now and make sure that they are firmly attached to the back over your painful area. Make sure that the electrodes are firmly attached to the wires. I'm going to add gel to the electrodes and make sure that the gel evenly covers the electrodes but doesn't overlap too much, because the electrical current will go wherever there is ultrasound gel. Just make sure it's contained within the 2 electrodes like this. Okay, so double checking the painful area is here, right? So a little bit cold. Please don't be alarmed. I'm going to put it on the left side first. It's a little bit cold, right? Sorry. So I've attached the electrodes to your back. Okay, we can see that well with the machine. Alright, so now I'm going to turn on the intensity. Let me know as soon as you can feel some tingling sensation. Are you ready?
Yes.
Okay. Anything? Some tingling now? Okay, now I'm going to turn it on so it's a comfortable tingling. It's not allowed to be too strong, but it should be comfortable. Tell me when to stop. Okay. Now it's comfortable. Some tingling, right? Okay. So we are using 23 milliamps and the treatment time is 20 minutes. Alright, so I'm going to set the timer for you. If during the treatment you feel any uncomfortable sensation or any pain, please alert me immediately. Also, please do not move, do not touch the cables because you're at risk for an electrical burn. Do you understand? Okay, so I'm going to set your timer now, and you can look at the timer and just relax as much as you can. Are you comfortable?
Yes.
Alright. Okay, so I'll come back in the middle of the treatment. Okay, Eli, now is the middle of the treatment. How are you feeling?
Comfortable.
Alright. Do I need to adjust the intensity a little bit? Do you think that
You can increase
a little bit, right? Because sometimes the intensity will be a little bit lower after some time. So I will adjust it a little bit for you now. How does that feel? Is that enough?
Yes, you can increase.
A little bit more?
Now it's okay.
Now it's okay. Alright, that's great. Okay, so now please just don't move until the end of the treatment. If you feel any discomfort or pain, let me know immediately.
Thumbs up.
Okay, time's up. Great. So I'm going to turn off the treatment and have a look at your skin and see if there's anything unusual. Do you feel okay?
Yeah.
Yeah? Comfortable. That's great. Do you think that your pain has decreased a little bit?
I think decrease to 5.
Okay.
Still pain,
You
but
still have pain.
not
That's
very
quite
high.
normal, yes. But it's decreased a little bit, so that's very good. So we can use this as one of our treatment modalities to help reduce your very irritable pain. Okay, so look at the video here. So your skin looks fine. There is no erythema. After cleaning off the gel and the electrodes, there's no erythema. So now I will let you get dressed and then we will teach you some exercise. Does that sound good? Okay.